Hello, everyone. It's another Wednesday with your fertility specialist. On behalf of ALPS Hospitals, I love to welcome you all to another exciting day with your fertility specialist. And I know that you're also excited to be with us today, like we're excited to be with you guys. As we get started, share this link with someone, call up someone, and like I would always say, if you need to send data to someone just to be able to get what you're about getting, please do that right away. I'm your host, Ruth Ogogo, for today's session, and I have a guest with me today. His name is Dr. Kenneth Eguda. It's good to have you, Dr. Ken.
Yeah.
Okay, for the sake of someone watching for the first time, just a little about Dr. Ken. He's a consultant gynecologist. He's a fertility specialist, a very, very good IVF specialist, one of the best you must know.
You want me to define myself now, right?
You can do it and more. Yeah, he's
Oh
also
boy.
a minimal access surgeon. As a matter of fact, he pioneered laser gynecological surgeries in Africa. So yes, that's just a little about Dr. Ken. I don't want someone to let's not cloud the whole session with this, but this is just a little about Dr. Ken. And today he'll be talking about diabetes and fertility. So for someone of that status, you know you are expecting a lot right now. So drop your thoughts, your comments, your question in the comment section, and he would surely attend to them. I'm sure, yes. I'm sure you would leave satisfied at the end of this session. So sit back and enjoy the show. Dr. Ken,
Mhm.
once again, it's good to have you. I must say I love your denim jackets.
Yeah. Thanks so much.
Oh yeah, so we're talking about diabetes and fertility. That seems to be a really, I think diabetes seems to really be something worrisome. Not so long ago, I was just trying to check statistics of diabetes. I mean, I'm sure there are lots that are not yet diagnosed, but
Mm,
for those that have been diagnosed, just for Africa as a whole, they diagnosed about 24 million people with diabetes. This was just as at even 2022. I'm sure it's more than that. And they are also thinking it's going to even, should I say, more than 100% increase because they said they are envisaging that it's going to be like 55 million of Africans by 2045. So that's more like it seems to be on the
mhm.
increase as the day goes by. And then I was trying to check, and then I saw that every year 1.2 million of Americans are diagnosed with diabetes. And I'm like, whoa, 1.2, we're not talking of 100 here. We're not even talking of a
Yeah.
thousand. It's really, really worrisome. So maybe just a little talk about diabetes so people have a little idea before we talk about its impact on fertility. Some might be wondering what diabetes is. Anybody that say diabetes, God forbid, is not my portion.
You know,
So
just this afternoon I saw the last person I saw before changing. By the way,
yeah,
I was wearing my scrubs. I'm tired of wearing scrubs. Before changing
this is not bad at all.
before changing to come up here, was diabetic.
Hmm,
He never knew.
wow,
You know.
say a lot
Oh yeah,
undiagnosed.
he never knew. When I mentioned it, it was like, God forbid.
Mm-hmm.
Then his spouse heard from a distance. No, it can't be.
Hey.
It's all right.
Hmm.
He can't be. My mom is diabetic, for quite a long time now.
Hmm.
Yeah, she currently takes insulin,
Wow.
so it's just everywhere,
Hmm.
just everywhere. So diabetes actually it's abnormality with sugar metabolism.
Hmm.
You know, there can be two types where
Okay.
an individual has no insulin at all. The chemical or hormones in the human body that takes care of sugar or that makes sugar get absorbed into the storage organs in the body is insulin.
Hmm.
You know, so and diabetes has to do with lack of insulin or insensitivity
So,
to insulin.
okay.
So the one with the lack of insulin, usually type 1 diabetes, where
Okay.
there's just no insulin at all.
Hmm.
So the sugar is just all there in the blood, and then
Yes.
just wreaking all the havoc.
Hmm.
Then the second type where you have insulin, but insulin is not very effective, or is not the receptors for insulin are not
Sensitive.
sensitive to the insulin, because of lifestyle, obesity, aging, genetics, and all of that, is the type 2. That happens with the aging population. That's the commonest type of
Type.
diabetes mellitus. So when an individual has the diabetes, the common signs is frequent urination. Frequent urination, and then you have a just incessant taste for water.
Oh,
You
wow.
feel like drinking water
Water.
all the time, and before you know it, it could be there could just be weight loss. And diabetes affect every part of the human life. It affects the eyes, it affects the heart, it affects the blood vessels, it affects the testes, it affects the ovaries, it
Wow.
affects the sperms, it
Oh,
affects the
no.
eggs, it affects the muscles, it
Wow.
affects the skin, everywhere. It's just
That's,
systemic abnormalities.
that's a
We
lot.
can't talk about what it does, all of these,
Parts.
but it affects all of this because of the problem with sugar metabolism. So, yeah, two types, type 1 and type 2, it is called,
Yeah.
and all of that. So, that's what diabetes. When I asked the guy I saw just this afternoon, you
Yeah.
know, uh, he was like, he has been urinating frequently. I said, well, that's already a sign. And sugar is just so high,
Hi.
and then we don't have to stop there. We have to look out for features of complications using other
Already.
advanced medical investigations.
Investigations. Wow.
That's what diabetes does.
So, viewers, you've heard a bit about diabetes. This is something that you shouldn't overlook. Not even in relation to fertility now, in relation to your general lifestyle, it's not something you should check yourself from time to time, whether or not. What's even your counsel to them with regards to sugar? Because some people too have their
When you
notions.
mention sugar, what comes to mind is the glucose kind of sugar or the sucrose kind of sugar. But sugar is way beyond that. The rice people consume is sugar. The yam they consume is sugar. Plantain is sugar. Corn is sugar. Just that they are complex sugar, polysaccharide,
Yeah.
complex sugar. They don't infuse into the blood as quick as the
Sucrose.
sucrose, glucose kind of sugar does. So most of the food we eat is sugar, you know. And then it is not just the sugar you use in making your tea or pap or something.
Because you hear some of them say, I don't take
I don't
sugar.
take sugar, but everything is
Sugar.
practically everything is
Yeah,
sugar.
that's true.
Just that some are more devastating than others. Okay, so yeah, that's it's just it's not the sugar per se that causes the diabetes. It is inability of insulin to act.
And sugar.
Either there is a lack of insulin or insensitivity to insulin that makes the sugar metabolism becomes a problem. And so when that becomes a problem, you have to watch the way you consume sugar, especially the rapidly absorbed sugar, which is the glucose, the sucrose, and all the things close to the refined sugar. You know, so that's the kind of sugar we're talking about
About.
here. Oh, yeah. So, but let me even tell you, there's a breakthrough actually in the treatment of diabetes
Okay.
now. Yeah. Just this afternoon,
Yeah.
a friend of mine, a very good friend of mine, sent me a publication
Okay.
about um, gene editing technology used to cure diabetes. And this
Wow.
individual has been declared cured of diabetes. Before now,
Yeah.
if you ask me before this afternoon, I know that diabetes is practically incurable. Yes, because one, there are different causes of diabetes. Some could be genetic, some could be some abnormalities with the pancreas, which we call from some autoimmune conditions and all
Okay.
of that. But an individual that was born with type 1 diabetes, which means he has no insulin. And before now, he has been on insulin
My
every
goodness.
day,
My
you understand,
goodness.
was declared cured following gene editing technology. The islet cells, there are cells that produce insulin. So the islet cells were genetically modified with
Okay.
gene editing technology like CRISPR,
Wow.
and then infused into him. And so that began producing insulin in him, in an individual with type 1 diabetes, start producing insulin following gene editing technology,
Yeah.
start producing insulin, and then he has gone off insulin
Insulin.
medication. So
Wow.
he's practically normal
That's really a breakthrough.
following gene editing technology. The islet cells were genetically modified.
Wow.
There was a long time ago I talked about even babies who were genetically modified following IVF that got this ability not to be infected by HIV. They're still
Yes. Mhm.
alive. And then, yeah, all you just do is just modify that
Yes.
part of the human life
Hmm.
that makes it susceptible to some abnormalities, infection, or anything. And in their case, they are CD4 cells, which are the cells
Hmm.
that the HIV virus binds to and cause all the damages.
Yeah.
So theirs were modified. So HIV has nothing to bind to.
Wow.
So they can be infected by HIV
Wow.
or with
Wow.
HIV, even if you inoculate them with the HIV virus.
Hmm. Hmm.
How how
This is-
how invincible. Talking
Yeah.
about homo deus,
Hmm.
superhumans. So this same technology can be applied to every part of human life.
Hmm.
Yes, including treatment for aging. And then you could actually affect the entire existence of mankind. So we'll keep it simple. Diabetes just got cured using the
Yeah.
CRISPR technology. At this moment, it may just sound like experimental, but this individual
This
is
was
already cured. And by the
cured.
way, CRISPR has been on, sickle cell has been cured, and some other genetic
Been
abnormality,
cured.
Hodgkin's diseases, have gotten cured following
Hmm.
CRISPR gene editing technology.
Wow.
So
Wow.
it's like the second coming of Jesus Christ.
So, viewers, I'm sure someone will be wondering, how do we assess this cure?
We can talk about that now.
Well, yes, it's it's not accessible to all for now,
Oh
but
yeah,
it's something that we
but
hope
yes,
that
this is a medicine for the soon future.
mm, so we hope it gets
Do you
really
know that the future
accessible.
actually is going to be very interesting? I'm talking
Mm,
with respect to medicine, where the existence of mankind would just be the way you think it.
mm,
Think it and have it.
mm,
Yes. Everything from human looks, the human ability,
yeah.
to longevity and
Mm,
disease control will
wow.
all be under control with just gene editing.
Wow.
Yeah.
As a lot. Now speaking of diabetes, now that you were mentioning cure, I'm sure that is also worrisome, and I'm sure some people are thinking, what's the reason for this increase? Because we were like, it's not the same food that our fathers were eating. It wasn't this bad in their time. What's the reason for this drastic increase or continuous increase with regards to diabetes?
You know, if you look at the history of mankind,
Hmm.
I'm talking about the existence of man, the evolution that brought us where
Yes,
we are. There's a
stay
lot of changes that
changes.
we have come through,
That's
you
true.
know.
That's true.
When I was in primary school, for instance, I used to trek a very long distance
Distance.
to get to school. And sometimes maybe under the rain, we get to school and get back
Mm.
home. But my kids hardly even trek um 500 meters before they
Mm.
hop into the car, an AC car, get to school, and then from school they get back home.
I know
Physical
that's
activities has gone
really.
almost to zero level.
Mm.
Then the food we eat is refined. a
Yeah,
good a good amount of the food is refined,
that's
and
true.
we do a lot of unhealthy
Food.
diets.
That's
You just
true.
mentioned America, the population that's been diagnosed with
On a
diabetes
yearly
daily.
basis.
What's the kind of food structure they have?
Mm.
The westernized processed floury food,
Exactly what they were
the
saying.
meat pies, the pizza, the
All of that.
donut, the
Mm-hmm.
burgers, everything there just carbohydrates. Well, of course there's a lot of vegetables and all of
No,
that to it,
yes.
but then the diet is processed, carbohydrate based often,
Processed food.
and then our lifestyle, sedentary lifestyle, and all
Mm.
of that. So it is maybe a change in diet, change in lifestyle,
That's true.
a lot of sedentary activities, a lot
Lifestyle,
of
a lot.
screen watching, and all of that. So
Mm.
all of this would increase our risk of having diabetes.
Diabetes.
You understand?
Mm.
Obesity is on the
Right,
increase,
that's
and with
true.
obesity, diabetes and
Diabetes.
hypertension
No far.
becomes very, very common.
It's
So
true.
these are all the things. So we have right now, we have actually over dieting.
Hmm.
Yeah, when I mean over dieting, excessive dieting, not diet to control weight anyway, but abnormal eating
Eating.
cause more problems than starvation is causing
It's true.
problems. Yes.
True.
So people in this dispensation die of overnutrition.
These days, a lot, even children are coming down with
Yes. And
diabetes.
diabetes is one of them,
Wow.
hypertension is one of them, obesity is one of them. And when you're obese, you have everything.
Everything. That's true.
So
Wow.
that's just the reason.
Diabetes. Well, if I have someone watching that is dealing with diabetes, yes, as much as we know that it's not a good condition to deal with, but we can only hope that you're able to manage it and maintain a good life till whenever it happens.
Yeah,
But
yeah.
yeah, we can just hope for that. Well, now let's talk about its impact on fertility because yeah, well, let's come back to
Uh-huh.
our fertility corner. Yeah, a lot about diabetes, but now let's narrow it down to how it impacts on the man, how it impacts on the woman.
Yeah, let's start with the man.
Okay.
You know, diabetes is not controlled. Undiagnosed or poorly controlled diabetes affects the reproduction, basically. One, it affects the end, the end blood vessels.
Okay.
We call them, yeah, the terminal ends of the blood flow
Yeah.
towards end organs like the testicles and all of that.
Okay.
Diabetes actually causes a clogging in the blood vessels, reduce supply of blood to some of the end organs, and affect the metabolism going on around these organs. Now, the sugar itself causes a lot of problems to development of sperms. And so you have a lot of abnormalities with sperms among those who are diabetes that reduce their chance of having quick pregnancies. And then if sperms are abnormal, the chance of having miscarriages or poor fertilization or abnormal fertilization is high. Then, of course, abnormalities with sugar metabolism increase you to what we call oxidative stress. And when you have oxidative stress, the organ of reproduction, or the cells of reproduction, or tissues of reproduction, becomes hardly hit with this oxidative stress. And all of these will increase what we call the DNA fragmentation in the head of the sperms. And then the higher the degree of DNA fragmentation, the lower the chance of achieving pregnancy, and the higher the miscarriages rate and all of that. So sperms are hit a lot with abnormalities with sugar metabolism, especially among those with diabetes who are not diagnosed or who are poorly controlled, who don't heed the doctor's advice on medications.
Sometimes because I think I've heard some people say that with diabetes sometimes the men, as if they find it hard to, is it ejaculate now, or they find it hard to produce when, could that be traceable to the diabetes
Yes,
or
if you have diabetes, diabetes has a lot of complications. There's a neuropathy. The nervous system get compromised. With diabetes. And that can affect whether the sympathetic nervous system, parasympathetic nervous system, and these are some of the systems in the body that controls erection, ejaculation, and sperm production. All of this.
wow.
So definitely, these aspects of the bodies can get compromised.
Wow.
They really can get compromised.
So as a man, you shouldn't joke with your, should I say, shouldn't joke with your sugar level now. As a man, because it makes, when there's a problem with sperm production, it makes you less of a man, I think.
Yeah, in my clinics, reproductive clinic, I've said some times ago that it's difficult to have men with very normal sperms. Sometimes I actually just wonder. Yeah, sometimes I just feel like going to the lab and check out what I look like. Seriously, because how can you see 20 men, for
Young.
instance, in a day, and just about three have normal sperms?
Gosh, this is
So
really
usually when we have abnormal sperms, we always look
want to
out
go and check.
for possible causes. And one of the quick one to check is the sugar. And most times you find some level of abnormalities. I just saw a guy just say this afternoon already
Yes, you
there was a
mentioned.
history of abnormal sperms. No diabetes was discussed. But of course, Yeah, we do a general check
Yeah.
before going for fertility care, just in case there are some metabolic conditions that needs to be
Yeah.
controlled.
So,
And then a guy rushed at my office, with the result that, hey man, there's a red flag here. The sugar is severely abnormal.
like,
Please get the endocrinologist to
to
take a look at
review.
it. I was like, okay, fine. But he never knew. He
Wow.
never knew. So yes, we check all of this because it affects the men very, very poorly. That's because we're talking about sperm. Diabetes
Yes.
causes cataracts,
Wow.
blindness, I mean, an abnormalities with the lens that leads to blindness.
Yeah.
You know, the retina, it affects the retina, which is what makes us to see from the eyes. It affects the blood vessels in the retina and all of that. It affects
A
everything.
lot. So as a man, yes, before we get to the women corner, as a man, you shouldn't joke with your health as a whole. Most times we feel women have more of these issues, but a lot of men are actually hovering around with all these conditions and they don't even
No, no, you
know.
should say that with some respect. How can you say men
Okay,
are? How
with
can you
all due
say?
respect.
How can you say that men are hovering around? What do you mean by that? We don't hover around.
Okay, with
We
all
just
due respect.
innocently don't know.
Okay.
It's better way to
Okay,
put it.
with all due respect, most of the men go to their offices not knowing that they have sperm conditions. Well, as much as it seems funny, but it's really not funny. A lot of men actually do not even know they have these issues. They don't even, sometimes they see this, they see the signs like this frequent urination you talked about. Some people say it's because the weather is cold. That's why they are, or they'll say I took a lot of water.
A
That's
lot of
why
water,
I'm
yeah.
peeing. And then you don't know some of these conditions are actually there. So as a man, I think it's not a bad thing. If you know it's in your family, it should be a regular check. But if you feel even if it's not in your family, a routine, if you feel you are not even at risk, I don't think it's out of place. That's this. So now let's move to the women.
Quickly.
Don't worry, women, I'm with you.
Yeah.
Yes, so to the women, impact of diabetes on the woman. I know it's going to be a lot, but let's just bring it
You're
on.
already feeling it's going to be a lot. Get to that end, all right? Yeah. As gynecologists, we always worry about sugar. You know, I could remember when during the residency period,
Yeah.
when we were training to become specialists in the conventional obstetrics and gynecology. When we have pregnant women who are diabetic, we young doctors don't see them. They are reserved for the most senior doctors to see because there are always points of decision making. Because I'm starting from the top
Yeah,
before
I guess
conception.
yes.
During pregnancy, sugar control becomes a little bit more challenging. Then, if it's not well controlled, the baby grows out of proportion.
Proportion.
And so you have women giving birth to, well, in this part of the world, any weight beyond 4 kg is considered big baby,
Macrosomic.
macrosomic baby. Diabetes is one of the cause. And when you give birth to these babies, sometimes they have difficulty um, establishing breathing in the regular world, this our
World.
world,
Yeah.
extrauterine world. Because their lung development was hampered
For
by
the
abnormalities
sugar.
of sugar,
Wow.
and things that helps to produce surfactants in the lungs. These like some fat lobes that helps breathing get established is
Okay.
delayed. And so you could just give birth to a 4 point something baby that you think should get up and be
And all,
walking immediately,
yeah.
but battling with difficulty with breathing.
Breathing.
Good number of them survive, but some do not.
Sometimes that's true.
you know and then because they have small head and big shoulders, I mean broad shoulders, if they are delivered through the vagina, they could get stuck because of the
So
diameter of the shoulder.
shoulder. Oh.
We call that shoulder dystocia. Sometimes you have to do all kinds of maneuver, maybe over increase the birth canal with all kinds of cords so you could bring out the baby.
Baby.
Or sometimes if it gets difficult, you could even fracture the clavicle to bring out the baby because of too much weight, too much size of the baby because of diabetes. you know then this baby is easily die in the uterus. We
Yes,
call it
that's a very common,
sudden and neonatal death
very
because
common
of abnormalities with sugar.
kind
Sudden
guy.
neonatal death could just happen. A woman is just fine going for antenatal
Then
care, and all
just
of a sudden the baby is just gone,
gone. Okay.
you know, because of abnormalities with sugar. Then often, they have what we call there's a fetal abnormalities that happen
Oh,
because of diabetes, where you have some skeletal abnormality, heart abnormalities, and
and all
all
of
of that
that.
happens because of sugar. Then a good number of them have miscarriage, early miscarriages, all because of sugar. Sugar itself, it's what we call teratogenic.
Okay.
Terat- any a substance that is called teratogenic means it has capacity of making a baby abnormal. So sugar, it's teratogenic all on its own, especially when you're looking at the first 8 weeks of life. I mean, from conception to eight
Yeah,
weeks.
yeah.
So it could give abnormalities with the heart, brain, skeleton, and all of that. So this is what sugar causes. And most times women just miscarry this thing because it's not
Okay.
compatible with life. And
That's
then they don't
true.
even know. So it's good when a woman has a miscarriage to check and really understand the cause of the miscarriage. Sometimes it could
Miscarriage.
just be sugar diabetes, you know,
Yeah.
that could be causing that.
Wow.
Then, of course, when you come down to this area of assisted reproduction
Production.
technology, when the sugar is bad, I mean, it's abnormal,
Yeah.
egg production becomes a problem.
Problem.
Fertilizing the eggs becomes problem. Having the eggs, I mean embryos that are fertilized, I mean embryos to get implanted becomes a problem, and pregnancy prospect becomes also a problem.
Wow.
Even response to medication sometimes becomes a
Wow.
problem. Yeah,
Wow.
because when you're giving all this medication, sugar may become abnormal
That's
in the
true.
course of doing that. So diabetes, whichever way it comes, whether before conception, during conception, and after, it's just a problem.
Problem.
And what is advised is if a woman is diabetic, for instance, you have to make sure that she is having a euglycemia, as in the sugar or the glucose level, the blood glucose level has to be
Yes.
normal before you start any form of treatment. And while she's on treatment, you have to keep an eye on the sugar.
Neat.
And if God
Yes.
helps her to get pregnant, you have to keep an eye on the sugar. At delivery, you have to keep an eye on sugar. If you're operating them, boy, you have to keep an eye on the sugar, because everything is
Okay.
just somehow when it has to do with pregnancy. And pregnancy hormones make sugar control a little difficult.
Difficult.
Yeah, yeah. So that's the way it goes.
Okay, so now you're talking about diabetes in pregnancy. I was watching a short clip on Instagram. I think that was on Sunday or so, and there was this lady talking about her pregnancy journey with diabetes. I think her first pregnancy, she was diagnosed with diabetes about the third trimester, where she was able to see through and pull through with her. Luckily for her second pregnancy, she didn't have to deal with diabetes. But her third pregnancy, even from first trimester, they picked diabetes. So she had to do insulins, and in fact, it seemed like she was still not even responding to the insulin. So what I was going to ask what your counsel is to people generally, because some people think that once they are taking insulin, they can eat as they like. The insulin is there to work on their sugar. People don't know really that lifestyle plays a major role in working on your sugar. They feel once you are taking medication, you have the luxury or liberty of doing what you like here. So what's your counsel to people generally on lifestyle management and how to manage the condition as in general? Yeah.
Yeah, you see, one, if anyone is diabetic, first of all, the person will need to be seen an endocrinologist, and there is no care for one diabetes that is similar to the
To the
next.
next. That's true.
Everyone has to be treated based on their own peculiarities.
Yeah.
There are some degree of diabetes that dieting and lifestyle modification could help. I've watched researches in England, for instance, where they change them to just vegetable diets and they just get
Wow.
okay.
Wow.
They just got okay. But these are type 2 diabetes, they just got okay, you know. And there are others that have to be on this insulin medication forever, you know. So the endocrinologists or the specialists in that field needs to
Yes.
see them and give them advice on which way to go in addition to the medication. And of course, when you have diabetes, you need to be seen by all kinds of specialists. sometimes it's endocrinologist, sometimes it's the cardiologist, sometimes it's a diet experts.
Yeah.
So you need all kinds of approaches. Sometimes it could just be a physical therapist to calculate the amount of calorie you need to be burning per time,
Yeah.
and then the amount of energy you need to be putting out at some point in time, and all of that. So yeah, there's just no one care for
The
everyone. Everybody just needs his own specialized kind of care,
care.
and the doctor seeing would have to guide the kind of care that they would have. But definitely, it's good to be under the care of a doctor.
Okay, so you don't just assume that. And once the doctor has seen you, it doesn't mean you don't have to go back for a check. You have to still keep your checks regular. And even while on medication, it means you still have to work on your diet. You still have to exercise. The sedentary lifestyle is a silent killer. I
You
think.
know what actually worries me with humans
Yeah.
generally, maybe around this part of the globe, is the fact that a good number of time they don't understand the place of prolonged medication
Medication.
in the care of chronic disease conditions like
Hmm.
diabetes and hypertension.
Hypertension.
Sometimes they see the doctor, and the doctor place them on
Sure.
medications, and then the sugar gets under control.
Control.
They now feel that they are
Everything is
fine.
okay. Yeah.
So they finish that course of medication and refuse to go back for check and
Yeah.
stop the medication. And the next time they get back with some complications of
Crisis.
diabetes. So you see, so these things don't just they don't get cured.
Cured.
And that is why in medicine we say management. You have to be managed consistently. And management means you do something today, you do another thing tomorrow,
Tomorrow.
all to just control the body system and keep the sugar under control. And so it may be one medication at a time, or you change it when there is need to change, you modify, you increase the dose. If the dose needs to be increased, you reduce it if it needs to be reduced, and hope that the person has a good life at the end of it. And if you, of course, privileged to have a gene editing medicine around you, then of course the prospect of cure is very, very near. It's very, very near. So that's just what I think. People should do that. It happens with hypertension a lot. You say you're hypertensive. No, I'm not
Not defensive.
hypertensive. I'm
Exactly.
not hypertensive. It's not in our family. It's not. But
No, they
which
start doing
family
all
are
the
you from?
rejection.
It's in there in the family.
They start doing all rejections.
Exactly. And then you place on medication. They take the first round of medication and they stop, and they avoid you as a
Yes,
clinician
that's
because
true.
they feel
True.
you're going to be policing what they're
Never
doing.
know.
But
Yes.
these things need to be managed.
True, true. So, viewers, there's just a lot about diabetes, and it's not something you should play with. It's not something that you should just overlook. And yes, once you have a family history, it's not far from you. Yes, while you are binding and casting, please don't be far from your physician as well, and don't be far from your regular checks and
Yeah.
your lifestyle as well. You need to
Lifestyle.
work on that. So, I was going to ask if you have this very, because I know you have a lot of wonderful clients. If you have these very stubborn clients that their sugar level is really overboard, and then maybe they are supposed to have an embryo transfer and they have very good embryos, what would be your counsel to such a client?
Oh yeah, there's no embryo transfer. It can't be embryo because the sugar is teratogenic. We said
Mm,
embryos are very primitive cells.
yeah.
Primitive cells. And those are the times that sugar wreak damage on
Mm,
lives. These first 8 weeks of pregnancy, of
yeah.
first 8 weeks of conception.
Mm,
That's when sugar is teratogenic often. So
mm,
why are you putting the embryos
yes.
into such hostile environment?
Environment.
So because it's going to get damaged.
Mm,
Yeah, if you succeed, it's just a chance thing.
yeah.
So if you have such kind of clients having abnormal sugar on the day of embryo transfer,
Mm,
for whatever reason they are missed, I don't know. But
mm.
then you're going to have to suspend the embryo
Embryo
transfer.
transfer.
You may have to freeze the embryos
And then
and get the endocrinologists or the diabetic specialists to take care of that sugar
sugar.
until you get to a point where the sugar is on a safe level to coexist with life, and you can now put the primitive cells.
So
Otherwise, you're preparing the woman to fail.
feel. So
Yeah.
viewers, just in case you've had to deal
And of
with
course,
this.
the medications used for IVF, the steroid medication, the estrogen, these are steroid medication,
Mm.
progesterone, steroid
Yeah.
medication. They can make sugar abnormal too.
More.
They can make
Wow.
sugar control a little difficult.
Difficult.
So you just have to stop until you get good control of sugar.
Control.
Then you can now put back the embryos at some other time.
Mm.
We've had to do that a lot. Just the same way that we would not take the sperm of a man who is diabetic to make an IVF,
Mm.
because that's the same thing. These
That's
sperms are
true.
coming from a hostile environment. They have
Environment.
high level of oxidative radicals,
Mm.
high level of DNA fragmentation. The prospect of having fertilization, development of embryos, implantation is very
Very
poor.
poor.
So
Wow.
it's better to stop it. And of
Yeah.
course, I see that often because sometimes we don't have privilege of seeing the husbands or the male partners,
Partner.
and they only come to give sperms.
Mm.
And then we quickly want to run some checks before the sperms, and sugar is just
Yes,
high
and
up
all of
there.
that. Mm.
And they never knew they had them,
Had this.
So we will have to
At
change
that
course of
point.
action.
Yeah.
So treat it first before you get the sperms. Otherwise, you're using a substandard gamete.
Garments. So this is to spread the mind of someone, just in case you might even have had that experience. Maybe they've told you your sugar is overboard. We don't think we want to proceed with embryo transfer. I don't think someone is just trying to punish you. I know, yeah, sometimes they feel like I'm already ready. Why do I have to wait? They are just so eager to take these embryos, but it's for your own good and it's
Mhm.
not out of place. Nobody wants to put you in that condition.
Yeah.
The best they want the best for you, and so do not feel it's out of place. Just embrace the cancer, and we hope that the sugar is control, whichever way. Well, as we wrap up on this session today, do you have any counsel to our viewers generally with regards to diabetes in general or diabetes in relation to fertility? What's your counsel to them?
Well, generally, I think if anyone is diabetic or has a sugar metabolism problem,
Mm.
you should open up to the doctors and let them know what the history is,
Mm.
and allow the doctors to do the investigations and to give you your best care.
Mm.
We don't need to hide our history because it is what we are.
Mm.
It's what we are.
Yeah.
Because if you hide the history, it even makes preparation to care for your baby a little bit difficult.
Difficult.
Because if we show there's a diabetic in your family tree or in your
Yes.
lineage, we keep searching for it until you
Yes,
deliver.
that's true. It's
So they
true.
should be open with the history,
Mm.
and yeah, and not allow the doctors to discover, because some
That's
patients
true.
actually just come to the hospital and keep all the history to
To
themselves.
themselves.
And
That's
one
true.
actually told me, we just wanted you to discover it yourself.
Oh wow.
Yes, we want you to discover it yourself. I say, well,
Oh.
you're lucky I did,
Hmm.
but if I hadn't,
Yeah.
so
Oh.
everybody should take responsibility for something. Yeah, it's okay for the doctor to discover, which is what the doctor is trained for, but you should be open enough to give the history
History.
so
Hmm.
it guides.
And the
Doctors are not
discovery.
magicians.
Yes, that's true.
So that's what I think people should do. And if you have abnormal sugar, get it treated while we are hoping on when the gene editing medical technology will
Becomes
become
accessible.
accessible to all. Because the
Hmm.
world leaders are thinking about that, not just
Hmm.
for diabetes, for long living.
Hmm.
Yeah, and that's what we're thinking about too.
So we look forward to when it becomes accessible to the world and then to Africa, because Africa is another special continent.
Oh yeah.
So we look forward to when it becomes accessible to Africa too,
Yeah.
as a whole. So viewers, even if it doesn't seem like you are likely going to come down with diabetes, maybe you feel it's not in your family tree. Who says you cannot start it up? Like,
Mm-hmm.
I mean, who says it can't start with you?
Mm-hmm.
And that's why the fact that it's not in your family line doesn't mean you should live carelessly, doesn't mean you should just go about life anyhow because you feel we don't have this in my genes, so I'm not likely to. You can start up with anybody, and sometimes some of the lifestyle you live can actually predispose you to this. That's why you need to work on yourself, and please stay healthy. Until we come your way next time, I knew you had a good time with us. Thank you for staying tuned. Thank you for always engaging us. Thank you, Dr. Ken. It was good
Thank
to
you.
have this with you today. So we look forward to seeing more of you guys. Have a lovely evening. Bye.